Good morning, everyone. Magandang umaga, Pilipinas. Salamat pagi, Indonesia. We welcome you today in our event program with the collaboration of SPICAS William Booth Health Science College in Surabaya, Indonesia, and the University of Baguio School of Nursing, Baguio City, Philippines. Let us now begin with this morning session by the invocation, followed by the national anthem and the national university hymn of both countries.
Let us all feel the presence of the Lord. Almighty God, our Father, we praise and thank you for this day. We come to you this hour, asking for your blessing and help as we are gathered together virtually. We pray for guidance in the matters at hand and ask that you will clearly show us how to conduct our work with spirit of joy and enthusiasm. Give us the desire to find ways to excel in our work. Help us work together and encourage each other to excellence. We ask that we will challenge each other to reach higher and farther to be the best we can be. We ask this in the name of the Lord Jesus Christ. Amen.
To confirm your attendance, kindly click the link that will be provided found in the chat box. You may also scan the code in our screen. For the webinar guidelines, the proper number one, the proper identification, please reflect your school, the name, provided your last name, first name in our Zoom platform. Please use only one account or device. For best experience, please utilize the stable internet connection in your device. Make sure to mute and turn off your mic and camera when you're not needed to avoid interruptions. After the session, the participant may chat their questions. This session will be recorded by BUB School of Nursing. We will be starting this 2022 partnership program webinar entitled Care for Older Adults. We are your host for today. My name is Genesis de la Cruz, one of the Faculty of Nursing in University of Baguio. Together with me is...
Hello, my name is Taufan Cipta Dermawan.
In this juncture, I would like to call in our beloved and enthusiastic Dean of College of Nursing in University of Baguio, Dean Helen D. Alalag, for formally welcoming us in this webinar event.
Thank you very much, Ma'am Jen. To our partners in Stikas William Booth, the President, Ms. Aristina Halawa, the Vice President for Academic Affairs, Ms. Lina Mahayati, the Dean of Diploma in Nursing, Ms. Reti Nirmala, faculty, staff, students, and community of Stikas William Booth, to the University of Baguio President, Engineer Javier Herminio D. Bautista, the Vice President for Academic Affairs, Dr. Janice Kaylin K. Lunogan, to our Program Chair, Ms. Evangeline Suliba, to our Extension Community Outreach Services Coordinator, Ms. Kate Banwa, the School of Nursing Management, faculty, staff, and students, to Wandan Nunya, Salamat Pagi, ladies and gentlemen, good morning. The coronavirus disease 2019, or known as COVID-19, created major changes in the lives of many people around the world, causing unprecedented challenges to the public health. These are measures to control the spread of infection, like wearing of PPEs, observing proper hygiene, and of course, lockdown that isolate individuals from their families and friends and brought difficulties in the world economy, limited access to physical and mental health care. It is true that these measures may be necessary to minimize the spread of the virus, but it created negative effects physically, psychologically, and socially. Several studies have suggested that psychological effects of the crisis and the prolonged lockdown includes increase in stress, anxiety, and even depression. Sad to say that these effects are strongly significant to the elderly population due to more strict lockdowns, higher threat of illness, and loss of social support. The elderly population are not only at risk of mental challenges, but even their physiologic aspect is also at risk. Older people have been discouraged from leaving their homes, even to perform basic physical exercises. This virtual lecture about mental health and joint pain management for the elderly will expand our understanding in mental health and joint pain management, and to identify the manifestation of mental and physiologic alteration for the elderly. To everyone, let us all sit back, relax, as we listen to our speakers this morning. Terima kasih, everyone.
Thank you, Dean Helen, for your warm welcome remarks. Before we proceed, we would like to inform you that we will be having an open forum later on. We encourage to prepare your questions to our speaker and they will answer that afterwards. Ladies and gentlemen, we are blessed this morning as we amp up with our very engaging and interesting topic to be delivered by our speakers this morning. Without further ado, I would like to call in one of our faculty in nursing, Ms. Myrisa Capili, for the introduction of our first speaker.
Good morning to everyone. It is both my privilege and pleasure to introduce our speaker this morning. She is a mother, a wife, teacher, coordinator, researcher, and resource speaker. She is a graduate of Pine City Educational Center for her BSN program in the year 1994, and she took her Master's of Arts in Nursing program and graduated in March 2011. She has a total of 18 years of teaching experience, 3 years from her alma mater, PCEC, now Pine City Colleges, and she will be celebrating her 15 years of service here in the University of Baguio in June of this year. With this extensive experience, she served the university in various functions as a faculty and a member of the School of Nursing Management team under 3 deans, Dean Helen Alala being her present supervisor. She became a subject head, an R&E coordinator, library and cost coordinator, and her most recent position as a review coordinator since 2014. With the full support of the administration, the SON, management, and faculty and staff, the School of Nursing was recognized by the Professional Regulation Commission as the top 4 performing school in the entire Philippines in the November 2021 board examinations. She is also a member of the Institutional Review Board of the University as an ethics reviewer. She has published 2 international journals together with Dr. Balay Udaw, Ms. Balisong, and yours truly, and one of these papers entitled Level of Depression and Suicidal Ideation Among UB-BSN Students was presented by her during the International Forum at the College of Asian Scholars in Khon Kaen, Thailand in November of 2019. As a teacher, her field of specialization is psychiatric nursing as well as medical surgical nursing. She also goes to affiliating agencies for follow-up duties in all general wards and specialty areas like the OR, DR, nursery, ER, and psychiatric ward. These are just some of her numerous accomplishments. I am sure that she is proudest when she is in the company of her husband, Engineer Avery Marbella, and their 3 wonderful children. Ladies and gentlemen, I give the floor to Miss Ivy May Marbella.
Please stand by as our technical team do the troubleshooting. Reminder, everyone, please click the link for your attendance, or you may scan our code for the attendance. Thank you. Let me remind you to please change your name into the family name and school name. Thank you.
Good morning. Good morning, everyone. Thank you, Ma'am Riza, for your warm introduction. This is actually my second time collaborating with the management and faculty of William Stickes Booth. I remember Ma'am Sandy and Ma'am Aristina last year, and also Ma'am Lina, when we collaborated on infectious diseases with the then departed Sir Wijar, and also one of the speakers there was Sir Hendro. I was coordinator at that time, and now I am proud to be with all of you once again to speak on how to maintain mental health, not only to aid our elderly, but also to give us a guide in their care. So before we talk about mental health, let us first have an overview of the ongoing COVID-19 pandemic. COVID-19 is a disease which is caused by a new kind of coronavirus, which has not been previously found in humans. And because of this, we are all experiencing a new kind of normal where we are continuously adapting to the changes that are brought about by this pandemic. Some people become infected but do not develop any symptoms at all. Most people recover from the disease without needing special treatment. In most cases, COVID-19 causes mild symptoms, including dry cough, tiredness, fever, though fever may not be a symptom for some older people. Other mild symptoms include aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. Although all age groups are at risk for contracting COVID-19, older people face significant risk of developing severe illness if they contract the disease due to physiological changes that come with the aging and potential underlying health conditions. Not to mention one of the groups most vulnerable to the virus. Older people and people of all ages with pre-existing medical conditions such as diabetes, high blood pressure, heart and lung diseases, or even cancer appear to develop serious illness more often than others. For seniors who may already have been grappling with social isolation even before the COVID-19 pandemic has begun, this time is even more challenging because aside from the normal aging process, which makes them vulnerable, they are also at risk for developing mental and emotional stress that may further lead to anxiety and depression. Our focus as nurses in the care of our elderly should not only dwell on the physical aspect of their well-being, but we should also consider their thoughts, feelings, and behaviors. We should be sensitive enough to look after these needs to enable them to maintain their self-esteem. This pandemic has been a tough time, not only for the older adults, but for everyone. Between spending our time cooped up at home, absorbing a constant stream of worrisome news, and seeing our finances take a hit due to the economic fallout brought about by COVID-19, it is hardly surprising that anxiety and depression are on the rise. Because of the economic and health burden that befell all countries of the world, mental and emotional illnesses are very common problems that affect all people from all walks of life, especially on vulnerable population groups like our elderly and our children. That is why I have some practical guidelines for us to help our older adults. But these tips that I will be discussing and sharing with all of you today may also be utilized, especially if we are experiencing some psychosocial problems of our own. So the following slides will help guide us in the care of our elder population and to give them a heads up in their daily activities as we care for them in a holistic manner so that they may establish routines that may help them maintain and improve their overall well-being. So first on our slide is staying connected. Social distancing and social isolation keep us separated from other people to be able to flatten the infection curve. But try to remember, social distancing doesn't mean social disconnection. In fact, it is really physical distancing that we are all engaged in now. It is more important than ever that we remain social, to connect with friends and family, and to talk about our feelings and thoughts. We have various ways on how to remain socially connected to both our friends, loved ones, and family. If you observe the picture in our slide, you can see that an older adult is so connected with his family even if he is separated from them physically. We still continue to communicate with one another using our phones, but today's video calling and conferencing apps are great for this purpose, allowing you to see your friends and loved ones' faces in real time. We have apps that are user-friendly, which can be used by our older population. That way, they can remain to be connected to their friends and loved ones in the comfort of their homes anywhere in the world. And what's more, they can see the faces and places of those that they are communicating with. So just like what we are doing now, we are far apart from one another, but through this Zoom meet, we are all able to see and meet with one another. We may all be physically distant, but we are all connected because of the wonders of technology. Another guideline that we may follow during this pandemic is setting a new daily routine. Since the pandemic has also caused a lot of changes to our daily routine, it is best to teach our older adults to follow a simple plan on a day-to-day basis. Consistency in our daily routines can give us something to anticipate and plan for. It will also keep our mind busy and engaged. So we have to follow a simple plan to the different usual activities that we do, starting from when we wake up in the morning until we go to sleep at night. There are also researches which suggest that meditation exercises can help reduce anxiety and stress and may help improve concentration and sleep in older people. Deep breathing, walking alone, or even with a companion, listening to our favorite music, and praying can also help improve mental and emotional well-being. So if this pandemic has ruined our daily activities, then we adapt by tweaking our schedules to lessen our stress and our anxiety. If you take a look closely at this slide, this is a very simple form of a meditation technique wherein we concentrate on the manner of how we breathe while thinking of a good thought. We can do this for a few minutes a day while resting or when we are even at work. Take time to breathe in and breathe out. Sit with your backs and necks straight, then just concentrate on the rise and fall of your chest while you are breathing. You may also close your eyes while you are doing this. You can teach this kind of meditation exercise to your older family members at home, and you may also try doing this on a daily basis. It will try to reduce your stress levels, help you relax, and it will also help you re-expand the lower lobes of your lungs for utilization of more oxygen consumption. Again, another guideline that we can follow during this pandemic to promote our mental health and also to maintain the mental health of our older people is taking a break from the news. Hearing about the pandemic nonstop, like any negative news, can be anxiety-inducing. So let's take frequent breaks from watching, reading, listening to news, stories, including the use of our social media. While it is great to stay informed about matters which affect our health, it becomes tiresome when it affects our way of thinking and feeling. So it is best to take short breaks between the use of our social media or watching television and doing productive activities that may help us relax, such as gardening, having pets at home, doing light chores that we enjoy, like baking or cooking, or even playing a musical instrument just to get away from the grind of the daily news. Taking some time from social media and watching the news can lower your anxiety and help you channel your energies into physical activities that can help you relax and enjoy. Another tip to follow in the promotion of our mental, emotional, and even physical health is eating a healthy diet and exercising regularly. Because regular physical exercise has been proven to ease anxiety, depression, insomnia, and other mental health issues. You can try home fitness ideas from the different social networks to stay active even when you are indoors. Exercising can help produce more serotonin, a chemical in the brain that gives us a feeling of happiness. Or you may get some sunlight to give you a feeling of comfort and warmth, especially in the early morning. To reap the most physical and psychological benefits, you can also try eating the following brain-boosting foods: fruits, green leafy vegetables, nuts, fish, lean meat, and eggs. It also doesn't hurt to add foods that boost your immune system, such as your citrus fruits, your broccoli, spinach, yogurt, almonds, bell peppers, to name a few. Get a good night's sleep. Sleep and mental health are closely connected, so losing sleep negatively affects our mental health, leading to more stress and anxiety. Since this pandemic has also taken its toll on our sleep patterns, try to improve your sleep by keeping a consistent sleep and wake up patterns. Include a wind down ritual that involves shutting off or putting off your gadgets in silent or vibrator mode an hour before you go to sleep. Limiting your intake of caffeine or alcohol, as well as eating a heavy meal before bedtime, can also help, together with clearing your bedroom of all clutter. Do include exercise and meditation because they are known to improve your sleep quality. If we are taking care of our elderly clients and patients, it is best to help them establish sleep-wake rituals and naps during the day may also be needed to help them feel better about themselves and improve their social disposition. Next on our slide is, let us be kind to others and be kind to ourselves. Let's give ourselves a break. What we are going through as a community and a planet right now is unexpected, and we are right to manage just about however we can. We are all feeling a sense of loss and maybe even grief because the world has changed so much and we are facing a lot of challenges each day. We may even be grieving for the loved ones that we have lost to the virus. So let us always be gentle and be non-critical of ourselves. Let us also extend the same courtesy to others as well. Let us give ourselves tasks that we can manage and keep ourselves occupied. Or you may also want to stay in a quiet corner and just meditate and pray, but we have to remember, love ourselves, encourage other people around us, and show kindness not only to yourself, but to others as well. Be kind to our elderly. We will become like them someday, so we care for them. We extend to them our kindness. We try to understand them and continue to encourage them during this pandemic. So the last of our tips or guidelines for promotion of the mental health, not only to our older population, but also to each and every one of us as well, is to seek help when we need it. Dissemination of accurate information is critical to ensure that older people will have clear messages and resources on how to stay physically and mentally healthy during the pandemic and what to do if they should fall ill. Let us educate our older clients to be prepared and to receive proper information and treatment by knowing emergency hotline numbers in your area. Counsel them to always keep in touch with their family and loved ones through your social media platforms on a daily basis. Remember, communication is a powerful tool to help us take care of ourselves and prepare ourselves for situations that may prompt us to seek proper help and treatment. We have here some available COVID-19 hotlines, both for Indonesia and the Philippines. So for Indonesia, we have our EOC under the Ministry of Health, the Hotline Emerging Operations Center numbers that you may call just in case that you need more information about COVID-19 and if there are problems with regards to the physical, emotional, and mental well-being of our older people. We also have in the Philippines our national emergency hotlines under the Department of Health for any kind of information that we may want to receive regarding our COVID-19. So again, before I end this presentation, may we all be reminded of the WHO protocols. Let us avoid the 3 C's, which is the first C is avoiding your crowded places. The second C is avoiding close contact settings. And the last C is your close and confined spaces. Let us always maintain a 1 meter distance from others, especially when we are in public places. Try to open our windows and doors for proper ventilation. Cover our nose and mouth when coughing or sneezing, and always wear a mask when we go out of our homes. Remember, if we are informed we are less anxious. And if we are less anxious, we can maintain our health in all aspects. Knowledge is power, and with that power, we can overcome this pandemic. I hope that you will be able to follow the simple practical tips that I have discussed to help us all be on the right track to maintain and improve our mental health, not only to those who are older, but for each and every one of us in this Zoom meet as well. Thank you very much for your invitation. It is a privilege to be with you all virtually. Thank you very much to our facilitators and coordinators.
Thank you so much, Ma'am Ivy, for such a timely topic. Indeed, we as a nurse must be aware, not only in physical, but also in mental state in caring elder adults. Again, any question from our speaker will be entertained later after the second speaker. For the participants from STICKES William Booth, you may ask your question in Bahasa and Sir Taufan will translate it for you later on. For those who still haven't confirmed their attendance yet, please click the link provided in the chat box. Thank you. Before we continue with our next speaker, let us now witness what the University of Baguio School of Nursing BSN1 student to be presented by Miss Jennifer Caratao, Gwyneth Ika, and Joshua Kalimlim prepared for us. Please watch and enjoy.
Matanda na, sana'y di tayo magbago. Kailanman, nasaan may ito ang pangarap ko. Makuha mo pa kaya ako'y yakan at yakapin. Hanggang sa pagtanda natin, nagtatanong lang sa'yo, ako pa kaya ibigin mo? Kung maputi na ang buhok ko. Pagdating ng araw, ang iyong buhok ay puputi na rin. Sabay tayo mangangarap ng nakaraan sa atin. Ang nakalipas ay babalik natin. Ipapaalala ko sa'yo ang aking pangako na ang pag-ibig ko'y laging sa'yo. Kahit maputi na ang buhok ko. nakalipas ay babalik natin. Ipapaalala ko sa'yo ang aking pangako na ang pag-ibig ko'y laging sa'yo. Kahit maputi, kahit maputi, kahit maputi na ang buhok ko.
Okay, thank you to Mom Genesis, who will be moderate the first speaker, and then thank you to Mom Ivy for the knowledge that has been given to us in this event. For all the participants, the next is a presentation will be delivered by Mom Martha. And before we start the next presentation, I will repeat again the information that after the session is a Q&A session. If there's a question for Mom Ivy or Mom Martha, you can ask directly or you can write it in a chat box. Now, I will introduce our second speaker today. This is Mom Martha. Mom Martha Laurani is a nursing lecturer at William Booth Health College, and she graduate master program in nursing community area from Erlangen University. She is an expert in the field of community nursing and especially elderly nursing, and she's also active researching in the field of community and elder nursing. So, without wasting our time, let's invite our second speaker today, Mrs. Martha Laurani Siagian. Please, Mrs. Martha, time is yours.
Thank you, Mr. Taufan. Hello, can you hear my voice?
Yeah, it can.
Thank you. Okay, now I'm trying to share my presentation. Okay, have you seen my presentation? Not yet, yeah.
Not yet, Ma'am.
Okay. Okay, while waiting the screen. Okay, I think already. Okay. Okay, I think all of you have already seen my screen right now.
Yes.
Okay, and I'm sure you all of you is understand very well about joint pain that often occurs in the elderly, but I'm very grateful for this opportunity that given to me. This was a privilege also for me to share information and experience. Thank you very much, and I hope you can enjoy my slide. Okay, we will discuss a few topics for today is about aging process that occurs in the elderly is characterized by a biological deterioration, and how can that deterioration can make health problems for the degenerative disease. We will talk about joint pain for this morning, and how we can manage the pain in the elderly so they can be activity and they can have a quality of life. As we know together, that elderly group is a high-risk group that increase various health problems. Yeah, and then for the aging process, the skin that begins to relax and wrinkles arise and gray hair and teeth become toothless and visible hearing and sight and easily to tired. And as we know, old age is a natural process, and there is no other can avoid that happens. Okay, now I just want to, I found some quotes that makes me interesting. They said, how can we live a life that is not only long, but also still functional, productive, and satisfying? And this is also a target of all of us when we already become in old age. Yeah, all elderly people wants to live. They want to live not only in a quantitative age, yeah, but also in qualitative, but also looks very functional and productive and satisfying for daily life activity. Like in these pictures, we also can see this is the old man and surrounding by the younger man, yeah, younger man that in the office situation, and he is still productive, very happy and enjoy his work with younger people than him. And we can also see this one is older people, this young lady and this old man also talk about something in their work environments, and they really enjoy, and they really looks like a professional in their job. And we can see also this old lady that she also check her office work, yeah, and he looks very curious, but I think she is very experienced also in her work, and looks like they are enjoy in their daily activity, even they have already have a long age. Looks very challenging for us. And I also see this kind of Buster Martin, yeah. I also take from the internet that BBC News said this old man become the oldest marathon in London. She take a marathon when he has 101 years old. It's really fascinating for me, and I really appreciate of his effort to take to take care of his life and his health during he can enjoy the marathon that government of London held in the old age 101, and to be sad that he passed away in 140. And he also productive, become a cleaner in that city, famous cleaner, because he have a lot of friends that knowing he's a good man. Okay, very interesting. And now, if we talk about elderly, it's really close with the chronic pain. It's always have a connection when you're getting old. Most elder people always have a chief complaint about pain. Yeah, a pain not in acute one, but in chronic pain. And chronic pain represents a significant economic burden. There is a research that said costing between $560 billion every year until $635 billion annually every year in healthcare expenses and loss of productivity. And then chronic pain can also contribute to suicide risk. This is very sad that there is a research by Petrosky 2015 that say from 360 examined found that 3,181 suicide deaths across 18 states between 2003 and 2014. Really upset news that they found that almost 9% of cases had evidence of chronic pain, like back pain or cancer, and arthritis being the leading cause of suicide in this chronic pain subpopulation. And we also find in 2016, chronic pain affected an estimate 20% of US adults, approximately 47%, which had high impact chronic pain. I think in Indonesia and Philippines also have deal with this chronic pain for the elderly problems. Okay, now common cause that aches and pain in the elderly, mostly by the arthritis. Arthritis is a musculoskeletal disease that causes joint pain. And of course, inflammation and stiffness can be happen. And the two common types of arthritis in the elderly are osteoarthritis and rheumatoid arthritis. Osteoarthritis, what is the difference between rheumatoid arthritis? Osteoarthritis is the progressive tear of joint cartilage. As it becomes less elastic, cartilage loses its ability to cushion the painful rubbing of bones against each other. Elderly people suffering from osteoarthritis often complain of morning stiffness and sharp or dull joint pain in the fingers, knees, hip, and spine. But in rheumatoid arthritis is an autoimmune disease, which means the body is attacking itself. It's characterized by sharp pain, swelling, and deformity in the joints of fingers, feet, and wrists. Joint pain and inflammation can be so severe that it becomes disabling in the elderly. Elderly people with rheumatoid arthritis often experience prolonged morning stiffness and warm and tender and swollen of joint. We can see the pictures. This one is a normal joint in the left side with cartilage, joint capsule, synovial membranes, and bones still in a good position. But in osteoarthritis, this happens when the synovial membrane or synovial oil is already almost gone, yeah. So the bone will attach each other that can cause very pain in osteoarthritis because bone and rub together, and we can see the thin cartilage. And for the rheumatoid arthritis, the difference is there is a swollen because of inflamed of synovial membranes, and there are some bone erosion. And this is happen in musculoskeletal disorders. There is a degenerative disc disease that happens when lower back pain and neck pain are very common source of chronic pain in the elderly. And depending on the effect, this person could experience neck pain, lower back pain, or sharp shooting pain in the buttocks on down the leg. We can see from the pictures, healthy disc, for the disc is look thick, yeah, but in the degenerative disc, it's thin, yeah, lebih smaller, and also can hit the nerve system in here. And when this in the neck and lower back have a degenerate, the soft material inside the disc may bulge out or rupture, pressing on the nerve or spinal cord. A slip disc is a common cause of a nerve pain and lower back pain in the elderly. And the other problem is frozen shoulders. We also find some symptom of frozen shoulders is common source of joint pain and stiffness in older people aged from 40 to 70. It may arise from prolonged shoulders immobilization after surgery or chronic pain condition such as arthritis, or frozen shoulders occurs when connective tissues around the shoulders joint thick and tighten. This is the normal shoulder joint, and this is a frozen shoulders. We can see the thick and inflamed capsule and look tighten. Okay, this is other symptoms, bone spurs. We can also know bone spurs is calcified growth that occurs along the spine and in the neck. Usually we found it in neck or shoulders and hips, knees, and feet. Aging and this degeneration and sport injuries usually contribute to the growth of bone spurs. We can see from the pictures bone spurs, and from the x-ray we can see the calcaneal heel spurs in Achilles. Looks very sharp. When bone spurs press on a neighboring nerve or tendon and ligaments, it may cause a lower back pain, neck pain, and joint pain in the affected areas. Tingling and some numbness are signs of bone spurs compressing on nerve. So today we will very concerned in joint pain about why we have to deal with the joint pain in the elderly and when the time is right and what happened in the elderly in joint pain and who that we will stick together and how we can deal with the joint pain in the elderly. We can discuss it in the next slide. So joint pain. Joint pain is a result that is given by the body due to calcification and due to other disease. And joint disorders in general provide symptoms in the form of pain that can disturb the patient. So the patient cannot be worked or move comfortably. And some of the factors that cause of joint pain are mechanism of immunity, metabolic factors, and age factors, excessive and repeated joint burdens, genetic factors, and environment trigger factors. Because as we know, aging is extremely variable process that older adults require more individuals management than younger individuals. Treatment's decision should weigh the risk of pain with the risk of treatment. In order to provide the most efficient and safe therapy approach in the older adults with musculoskeletal pain, the identification and frequent re-evaluation of the cause of the chronic pain and the impact of the patient general medical states are very crucial. Recent studies have increased our understanding of the environmental trigger factors, modify risk for rheumatoid arthritis, such as smoking and alcohol intake, and other factors such as social economic can be also demonstrate to contribute to the risk of joint pain. Okay, next, how we can give our time, how we can care of older people. It needs some consistent from ourselves, and we can make first discuss potential resources like ask the family members, discuss the positive and negative consequences, and find the solution. And after that, we can agree on a plan of action, agree on 2 or 3 most acceptable alternatives, be flexible, suggest a time frame, and make us time frames and criteria for evaluating the plan of action that we have arranged. And then also we can assess the decision-making situation about how many family in living together in one house, and what are the typical decision-making pattern of that family, and what is each person perception of this situation. So all the family member that live together should have a same perception for this situation. And for the next, involve the elderly. Surely we have to involve the elderly. We identify the best approach, the most realistic level of ability of that elderly. So we don't push them a lot, but give them relaxation or give them time to rest if they looks like they tired. Next. This one, for the pain management, we need an interdisciplinary team approach that use a multi-dimensional pain strategy and integrates the patient unique experience and perspective may help achieve effective pain management and treatment with the goal to improve the patient well-being, functionality, and quality of life. And we also, for this interdisciplinary team, not only a doctor, a nurse, but also we need to hand in hand with a family, with all the members of the family, yeah, grandson, granddaughter, father or mother-in-law, son-in-law, and daughter-in-law. Every member in the family should take a part on it, and then other disciplinary team also can be the dietitian or physiotherapist, analyst for the laboratory, and etc. Lifestyle factors may also play a role in contributing to the chronic pain because low level of physical activity will be make this pain more risky or more happens in the elderly. So this is the picture, for example, the interdisciplinary team. Maybe the teachers also, or the friends, close friends can be contribute. And they should sit on together and discuss what is the best what is the education topic or information that gathers to make these old persons more active and get more healthy. So the education topic and information that older people need are about joint assessment and exercise. A lot of exercise can be practiced and can be do together, and massage also, massage and joint protection. Maybe if they need some what we call some protector to protect their joint, we should facilitate that. And then medication, of course, and depression management. Already Mom Ivy have already shared a lot of things about mental health, yeah, to prevent the depression. And then the diet also, yeah, healthy diet for the elderly, less oil, less sugar, less salt. And then healthcare approach. We have to give them our heart genuine. So we will ready to concern to their problems. And about the concern to develop and evaluate a joint health management program, basically from gather the information and raise the motivation and effort for the behavioral skills, we have to setting and achieve our goals, and we a lot to do, like a sharing experience, doing telephone counseling, and do some self-monitoring. And this is, we will gonna do assessment of pain components. Nurse assess the following components of the pain experience. I think you should very very known about the PQRST, yeah, for the intensity and impact of activity daily life and how the quality of pain and where is the location and what is the physical finding when somebody get pain, and are these a temporal characteristic or permanent characteristic, and then what is the aggravating and alleviating factors, and analgesic history. This is really important, and patient goals and expectation, we should know it, and about what is the meaning of pain and the patient attitude to give and to support about the mindfulness. For the factor affecting and the experience of pain, this kind of things will make worse pain. There is insomnia, anxiety, fear, isolation, boredom, anger, sadness, and depression. And all of that kind of situation will make the pain getting worse. But other side, we can see how to reduce the pain. First is non-pharmacologic approach that very not too costly, and medication should also, and have a sleep or rest enough, like Ma'am Ivy have already told us about this morning. And then we understanding the and validation to the person by person of the elderly that we facing, and then companionship. So these elderly cannot feel lonely. Yeah, we always routine visiting them and talk to them, and then diversional activity like gardening, dancing, maybe walking around the street, yeah, or shopping, and then reduction in anxiety. Yeah, reduction in anxiety can be sharing to another person, yeah, and then we can build the senior or elderly trust, yeah, so they not be paranoid to us, and then we can boost their elevation or of mood, yeah, by maybe giving some reward or giving something that they really like cooking or making something food that they love and they feel happy to get it. Maybe just a simple, like we recognize and we know, we remember when that day birthday, maybe, yeah. We just say happy birthday without any present. They have already happy of that because they feel really close and happy for somebody, other people still recognize about them. And the next slide. Continue. Nurse can apply the following guidelines for pain management. It's already a lot, yeah. If we browse for the pain management guideline, it's a lot information that we can gather together, and we can learn and caring our patient from various cultural backgrounds. This is very important also. If we know the culture of the background, they will be more easily to get connected with us. So as a health professional, we have to learn the nuance of cultures rewarded with the knowledge they have are more effective in manage the pain of our patient. And also knowing the background cultures better able to help family and friends of our patient to adjust the treatment process. And we can also be sensitive to the different style of communicating pain. For some people, they can cry, but other people, they just quiet. It's already the communicating. That's how they communicate that they feel something inappropriate in their body. So we can just be sensitive to a different style of communicating in pain. And also we can use appropriate assessment of tools that we may also have from our lecturers. From the nursing fundamental, from the basic nursing, we also get known this assessment tool for the pain. There are verbal description scale or VDS, and numeric scale, and visual analog scale or VAS. And we can also use the Wong-Baker phase for the kids or children. And for pain management, for the treatment of aches and pain in the senior or elder people, in pharmacology, we can also have a pain relief medication such as short course of NSAID, non-steroid anti-inflammatory drugs, and can reduce the joint pain and joint inflammation. And also we have an anticonvulsant and antidepressant medication to relieve chronic nerve pain and muscle relaxant for backage, lower back pain, and neck pain. And we can also add some various injection of local anesthetic with a small amount of steroid, or even we can suggest for surgery. And for non-pharmacology therapy, we present some of alternative that we may use. Some physical therapy as we avoid prolonged bed rest, because prolonged bed rest can poor to the treatment, poorer the treatment. And then massage with essential oil or sauna with cold and warm water, like that. And body or energy work, such as we can practice the Reiki or Tai Chi, and also acupunctures or chiropractic or naturopathic care. We can also do that. And for the behavioral or mental health therapies, we can also do, and pilates, yoga for aromatherapy, and music therapy we can also do for the exercise. As we know, physiotherapy and exercise is really need to strengthen the back and abdominal muscles and can reduce joint pain and improve the flexibility. As we know, Reiki or Tai Chi is Japanese energy therapy that complement medicines to guide energy through the body to encourage self-healing. And chiropractic or naturopathic care is a form of primary health care which combine modern science with a holistic and proactive approach that concentrates on fortifying up solid musculoskeletal and nervous system to promote general wellness. And for the pharmacological therapy for the chronic musculoskeletal pain is the most effective when combined with the non-pharmacological approach, such as physical therapy, exercise program, TENS, or transcutaneous electrical nerve stimulation is a method of pain relief that involves the use of mild electrical currents, the mild one, and application of heat or cold, and psychological method like relaxation, biofeedback, hypnosis, cognitive behavioral therapies, educational programs that we have already taught in slide 14, and social intervention and complementary and other complementary therapies like acupuncture, Reiki, yoga. Okay. In an older people where the risk of adverse event is higher, the non-pharmacologic option will usually cost less and cause fewer side effects. This is from article or research. And description of the successful aging. We have to make ourselves from now, or we trigger, or we can give motivate, or we can invert our elderly that live with us to be active engagement with the life, and then high cognitive and physical function and low probability of disease and disability. That's from Rowe and Kahn, the gerontologists, the expert of gerontologists. To prevent research center on healthy aging research network for the longevity, leisure, spirituality, social involvement, continuous learning, and good physical and cognitive health as an essential aspect of a successful aging. And this is one of my interesting in gerontology. I have been some research on it about ergonomic gymnastic when the elderly people who experience joint pain disorder, so we trigger to do exercise action motion. So there is no decrease in the range of motion in the elderly or the decrease in muscle strength in the elderly. One of the exercise for active motion is by doing ergonomic exercise. Ergonomic gymnastic is one of methods that is practical and effective in maintaining body health. These ergonomic gymnastic movements are accordance with the rules of creation of the body, and one of the style is like a prayer movement. I will show you the pictures. And from the results, from the data demographic, when my research, I get 110 respondents, and 71% is old people, from 61 to 70 years, and most of them, 84 people are females and housewife or an employee again, or not working again, for 93%. And those who experience mild pain before ergonomic exercise perform 26%, and moderate pain 74%. But after doing the ergonomic exercise, the mild pain increase, become 60%, and moderate pain should lower, become 40%. This is one of non-pharmacological non-pharmacology therapy by doing some physical therapy. We choose the ergonomic gymnastic. This is the result for mild pain in pre and post test. And if you interesting, you can visit the journal also, as published in Journal Nurse in Universitas Airlangga for the complete article. And then from the discussion, as we know, the aging process will cause anatomical and physiological and biochemical change in the body, so that will affect the body's function and ability as a whole. And female, why female is most cause of the osteoarthritis? Because decrease in hormone estrogen at menopause, and these hormones play a role in the loss of bone mass, which result in a joint pain sensation in the elderly. And for the status education is according to the lack of information, and the activity according to the other research activity will also can get the human system and prevent inflammation in the joint that have sign of joint. For the conclusion, they show that ergonomic gymnastic or exercise really need to the elderly for the practice routine to make the synovial fluid enclose or lubricant the joint, and it will decrease the stiffness in the joint and reduce the risk of injury that will prevent joint pain in the elderly. And elderly people are very important to maintain health by exercise safely for the body to avoid injury. And this will help by all of us in this Zoom meeting, can be maintained, can be evaluated, can be asked the older people to come on, get some active exercise. Okay, this one is for the movement of the ergonomic gymnastic, and I have found some videos in the YouTube that can give you some describe how we can do more the ergonomic gymnastic. Please, Mr. Boban, can you help me to share the videos? Okay, that's a simple movement that we can introduce to elderly around us to make them practice regularly to reduce the joint pain for the better quality of life. And this is back to my screen. And this is my reference. Okay, excuse me. And this is the last but not least, my reference that I use. And this is the nice quote. Age is a simple, the number of years the world has been enjoying you. Hello from us. This is the staff and lectures of some of the Stickers William Booth. And we also can see Mr. Wijar. This is the old pictures. He's still there. And I believe right now, Mr. Wijar still with us and smile and see what we have done today. Thank you very much. And keep going to make older people around us getting healthy by day by day. Selamat, terima kasih, thank you, very pleasure to meet all of you. I give it back to Mr. Taufan, Master of Ceremony of Stickers William Booth.
Okay, thank you, Mamarta, for the presentation today. So the next session is intermission. The intermission will be filled by singing performance. And then this performance was made by nursing student at William Booth Health Science College. They will sing a traditional song. And this traditional song shows a sense of mutual love and give encouragement to those who listen. I hope you all enjoy it. Can you play it?
Indonesia tanah air beta pusaka abadi dan jaya. Indonesia tanah air beta pusaka abadi dan jaya. Indonesia sejak dulu kala, tetapi puja-puja bangsa. Di sana tempat lahir beta, dibuai dibesarkan bunda, tempat berlindung di hari tua, sampai akhir menutup mata. Tempat berlindung di hari tua, sampai akhir menutup mata. Rasa sayang-sayangi, Elia dari jauh. Rasa sayang-sayangi, Elia dari jauh. Rasa sayang-sayangi. dikejar ke dalam pasar, cobalah cari. Masih kecil rajin belajar, sudah besar senang lagi. Mana kancil akan dikejar ke dalam pasar, cobalah cari. Masih kecil rajin belajar, sudah besar senang lagi. Rasa sayang sayangi, lihat dari jauh. Rasa sayang sayangi, rasa sayang sayangi, lihat dari jauh. Rasa sayang sayangi. Kalau ada semut di ladang, boleh kita menumpang mandi. Kalau ada umur yang panjang, boleh kita berjumpa lagi. Kalau ada semut di ladang, boleh kita menumpang mandi. Kalau ada umur yang panjang, boleh kita berjumpa lagi. Rasa sayang sayangi, lihat dari jauh. Rasa sayang sayangi, rasa sayang sayangi, lihat dari jauh. Rasa sayang sayangi.
Our delegates, students, and audience, your question will now be entertained by our speakers. Feel free to raise your hand, unmute your microphone, or type it in the chat box if you have some questions. Okay, we have a question here. A question for Mom Ivy. Since seeking help when we need it is one of the approaches in maintaining mental health, are there any cues we need to watch which could indicate that it's time to seek for help?
Thank you very much for your question, Miss Felipe. So when we are going to seek help for our mental health, if we think that there is something wrong with our mental capacity or our mental abilities, then we have to look for cues that may warrant particular persons to seek help for this particular symptoms that these patients may have. So what are these cues that we see or we observe in people who have a problem in mental health? Maybe these people are isolating themselves. So that is one of those cues that we may check. Isolation, there is a problem with their eating patterns. If there is also a problem with their sleeping patterns, and if they start verbalizing their needs and concerns and they need someone to listen to them, so those are already cues that there is something wrong with the mental disposition of a particular patient. So other cues are maybe if these are students or if these are working employees in particular institutions, maybe they are often absent from work. They do not communicate with members of their family or members of the school or the institution where they are working off. If they are students, they usually are isolating themselves by being absent, and also they try to stop contacting their friends and family members. So those are immediate cues that we can observe in people who have problems with mental health. So if we see these cues in our students or in our fellow co-workers or faculties, then maybe the best thing for us is to try to reach out to them. So we start to reach out, we start to communicate with them and to check whatever problems we may be of help with. So those are the cues that are immediately seen or observed. I hope that I was able to answer your question, Ma'am Felipe.
Any more, guys? Okay. Since there are no more questions from you guys, this is where our session ends. We want to express our deepest gratitude to Ma'am Ivy Marbella and Ma'am Martha Laurani Siagam. In this moment, let us present to you a certificate of appreciation.
Thank you very much for Ubi.
Extension and Community Outreach Service through the UB Cares program award the Certificate of Appreciation to Ivy May V. Marbella, MANRN, for satisfactory contributing to the rectification of university's mission, vision, and objectives in providing balanced quality education to its stereotype by being the resource speaker during the webinar series event, Care for the Older Adults, given this 20th day of February 2022, University of Baguio, Baguio City, Philippines. Signed by Grace Dunyas, Director of ECOS, and Ma'am Helen D. Alalag, RN, Dean of School of Nursing.
Thank you very much for the opportunity and the privilege.
Yes, thank you also for the opportunity, and nice to meet you all. Thank you.
Sir Taufan.
Okay, and then this is the certificate of recognition to Ma'am Martha Laura Disiagian, SCUP Nurse MCUP, for contributing to the recitation of the university mission, vision, and objective in providing balanced quality education to its stakeholders by being the resource speaker during the webinar series entitled Care of the Older Adult. Given this 24th day of February 2022, University of Baguio, Baguio City. Director, Grace C. Durnas, and then the Dean of School of Nursing, Ma'am Helen D. Alalak, MANRN.
Thank you, Ma'am Grace. Thank you, Ma'am Helen. Thank you for the opportunity. Thank you, Mr. Taufan and Ma'am Genesis, and also Miss Ivy. Thank you.
Okay. And then the last of our session is closing remarks. The closing remarks will be given by Ma'am Lina Mahayati. Is there ready, Ma'am Lina?
Yes, Mr. Taufan, thank you.
Okay, Ma'am Lina, time is yours.
Thank you, Mr. Taufan. The Honorable Lieutenant Colonel Hosea Makagiantang, as the Salvation Army Foundation representative, Mr. Herminio Javier Batista, as President Academic of Baguio University, Mrs. Janice Lonogan, as Vice President Academic of Baguio University, Ms. Helen Halala, as Dean School of Nursing of the Baguio University, lecturer and staff of Baguio University, lecturers and staff of Stikus William Surabaya, all the students I love both from Stikus William and from Baguio University. Praise God, good morning, and best wishes to all of us. Praise and thank you to God for His blessings today upon us, that we can hold His special occasion, joint lectures between Baguio University of Philippines and Stikus William from Surabaya. I give my highest appreciation to Ms. Ivy, who has provided material on mental health of the older adult, and Ms. Martha Laurani Siagian, who has provided material about joint pain management, which are very useful for all of us. I also appreciate all students who have participated in this activity, from beginning until the end of the lecture and from those participants who have been active involved on this event. As our theme of today is care of the older adults, I'm very glad that the lecturer today has bring enrichment to our knowledge and skills in caring for the elderly people from both mental health and physical health perspective. I saw that enthusiasm of all participants in this activity from beginning until the end. We hope this kind of activity like cultural exchange, joint research that we have done before, sharing knowledge like joint lecture event today will be continued in next activity and also can be strengthening our international relationship. Once again, I thank you all and my highest gratitude to the Dean of of Nursing of UB who has been willing to collaborate and hold this event and will continue to carry out several activities that we have planned together. The entire committee who have prepared this event very well, lecturer resource persons who have shared knowledge and experience with us, and all the extraordinary students who have responded and attended this activity from Baguio University and Stikes William Wood. Terima kasih. Thank you. Selamat. Thank you, Mr. Topan. Time is yours.
We also thank you to our dear technical team and our other working committee to be headed by Ma'am Kate Banwa. This event will not be possible without your effort. Again, we thank you everyone for your time and participation in this webinar event. We hope to see you again next time. For the evaluation, kindly click the link posted in our chat box. To our delegates, kindly open all your camera for the photo ops. Thank you. Please open all our cameras. Okay, 1, 2, 3, smile.
Smile.
Okay. One more. Please hold your smile. Yaman sila. Hold your smile. We have 350 participants here. Congratulations for everyone. See you again next time. Looking forward for more webinar like this.
Yes, thank you very much.
Thank you,
Thank
Ma'am
you,
Genesis.
Thank you, Ma'am.
Thank you, Ma'am Ivy.
Thank you for
Also,
all. God bless you.
Thank you. Have a lunch day.
Thank you, ma'am.
Bye. God bless.
See you
see you
again.
again.
See you, Ma'am
Thank
Ellen.
you.
Okay.
Till our next collaboration. Thank you.
Thank
Okay,
you.
thank you.
Thank you all.
Okay.
200. Link nasa chat box mo.
Thank you, Mom.
Thank you.
Thank
Thank you.
you.
Thank you so
Don't forget to
much.
click the link for the evaluation. Thank you very much.
Okay.
We will.
Tulisannya ruwetnya nih ya. Terima kasih ya tulisannya ruwet.
Selamat. Bahasa sana.
Sudah.
Thank you. See you again.
See you again, Mom. Thank you.
Thank you. Thank you.
Thank you.
Thank you, Mom Kate. See you.